Hi everyone, Dr. Jeff back with Fiona this week, and we got a great topic again this week, which is going to be
the importance of gluteus medius.
So the gluteus medius is actually a butt muscle. It's kind of where your back pocket is. That's your gluteus medius, and it's a very important muscle. And actually, kind of attached to the back of the ilium here. Last week talked about the hip flexor, which is on the front. This is on the back of it, and it runs down. If you feel the side of your hip here, you got a big bump. That's called your greater trochanter. So this muscle kind of runs down, kind of wraps around the greater trochanter. There's actually 3 fibers to it. So one fiber kind of just all it does is kind of lift the leg sideways. Another fiber will actually bring the leg back, called extension. And the third kind of rotates the leg out. So there's kind of 3 fibers to it, to the gluteus medius.
Okay, so why is the gluteus medius so important? Well, it stabilizes the pelvis during walking.
So with the gluteus medius, it's very important for stabilizing when you're walking. So it brings the leg out, brings the leg back, and also does some rotation with it. And I found, it was interesting when I found that when I had my hip surgery, that one of the first things they had me doing was trying to get my gluteus medius firing up again. I didn't think I had a weak gluteus medius, but when they did the test, it was quite weak. So they had me really working on that. Because what happens is if the gluteus medius is weak, what can happen is that pelvis is going to turn backwards a little bit. We know from dealing with the psoas last week, the hip flexor, that when your pelvis moves, that affects the low back. So that's going to create a hyperlordosis in your back. So you can have more of a curvature in your back. That causes issues with your discs and the muscles in the back. It also is going to cause your femur to kind of turn in, cause your tibia to turn in, to cause your foot to turn in. So this can cause all sorts of problems with your hip joint. With your knee, we talked about Q angles and patellofemoral syndrome before. Coming down can cause your shin splints. Into your foot can cause some foot issues, including plantar fasciitis. And actually, we have a workshop here next Monday on plantar fasciitis if you're interested in coming to that. So a lot of people don't know they have an issue with the gluteus medius until they start having other problems.
Yeah, so some of the signs and symptoms of weakness of gluteus medius is severe limping, but there's also lower back pain, also hip, knee, and foot issues, like mostly alignment issues.
Yeah, I know. Generally, when you come in with knee pain, one of the first things physios or chiros or sports chiros will look at is going to be a gluteus medius, because we talked about the Q angle before and how important it is. And when you get an exercise program for knee pain, generally it's always going to include some gluteus medius exercises.
Yeah. So how do you test for weak gluteus medius?
There's a couple tests we do. If it's really weak, we can do the Trendelenburg's test. So if we get you to sit up here or stand up here for me, one thing we'll do is we'll get Fiona just to step up on each foot, back and forth. And what we want to see is we want to see the hip kind of staying kind of level. We don't want to see it shifting. What can happen if you have a weak gluteus medius, what's going to happen is when you lift the leg up, the other side is going to drop way down. You see how everything kind of drops down there. That's a sign of a gluteus medius. But really, for a Trendelenburg's test to be positive, it really has to be quite weak. So another test we can do is just get her lie on her side here for me. So one thing to do, this is what they did for me when I had my hip surgery, is we lift the leg up. We know it does abduction, we know it does extension, so we put it in that position. She's going to push up in my hand. Good resistance there. That means it's in good shape. When I had my surgery done, you could take 2 fingers here and push it right down. It was so weak. So I was walking with a limp, and so before they let me really do anything, I really had to get my gluteus medius going so that it would stabilize my hip. What causes a weak gluteus medius?
The number one would be posture. So if you're standing in one spot for 20 minutes or sitting for 20 minutes or longer, that's how long it takes for the gluteus medius to fall asleep. And trauma. So like Dr. Jeff said, his hip surgery.
Yep. And what do we do for it?
So some exercises that we could do to strengthen your weakened gluteus medius is, one of them is clamshells. So if I lie on my side here, okay, and then make sure to kind of touch the muscle here, which is your back pocket area, and then you're just gonna make sure when you do this, like this, just feel that the muscle is activating. Okay, and then the next one is lateral leg lift. So make sure to actually extend your leg a little bit to activate the muscle, and then up and down. Okay, and then the last one is glute bridges. So you're just gonna pop it up like this, hold it for 5 to 7 seconds, and you're gonna do it for 5 to 10 times. Okay. Okay. You can also, if you're feeling comfortable with the exercises, you can also progress it. So adding one of these bands to your ankle or knee to add resistance. Thanks for watching. If you enjoyed this video, please give it a like and subscribe, share it with your friends and family, and comment down below if you have any questions or any future video ideas. And as we say at Goals Ready Wellness, we got your back.